datang Indonesia tarafından nasihat memulai kanunlar sudah disebutkan Muslimlar di Indonesia.
Now let me congratulate Indonesia being elected as the chair of the fourth session of the Islamic Conference of Health Ministers and other members of the Bureau. I welcome Your Excellency Dr. Nasir Ngoy, Minister of Health of Indonesia. Congratulations.
Your Excellency Mr. Eric, Vice Minister of Health of the Republic of Kazakhstan, Chair of the Third Islamic Conference of Health Ministers, Ambassador Bukhari, Assistant Secretary General of the Organization of Islamic Coorperation, representatives of international organizations, distinguished delegates, ladies and gentlemen, a very good morning to you all. First of all, allow me to extend my warmest welcome to all of you as distinguished delegates in this important fourth session of the Islamic Conference of Health Ministers in Jakarta. I hope that you have been able to recuperate from the long flights so many of you had coming from your respective countries. I also thank Your Excellency, the Assistant Secretary General, for his inspiring speech this morning. Indonesia is honored to host this conference at a time when the OIC member states, together with the other members of the international community, are jointly working to address so many important challenges we face as we improve the health of our people. I wish to thank all delegates for entrusting to me the chair of the fourth session of the Islamic Conference of Health Ministers of the OIC member states. Let me also, on behalf of the government of Indonesia, extend our thanks to the government of Kazakhstan, which held the chair of the ICHM prior to Indonesia. Our appreciation was especially to Her Excellency Mrs. Coorperation the Minister of Health of Kazakhstan, represented on this occasion by His Excellency, the Vice Minister of Health of Kazakhstan. We are grateful for the stewardship shown by the Minister in advancing the common objectives of the Islamic Conference of Health Ministers for the past 2 years. Kazakhstan has led our cooperation in an outstanding way, heeding our strong sense of collective values and our aspirations for solidarity, which ensure the continued cohesion and relevance of ICHM in addressing health challenges in our respective countries. I am confident that with the strong spirit of Ukhuwah Islamiyah, the Islamic solidarity, we can make the most of our present meeting and work in harmony to overcoming health problems for the sake of the Ummah's welfare across the OIC member states. The challenges we are facing today require us to work hard to strengthen unity and health cooperation, thus assuring progress on our own national goals and targets, as well as intensifying our contribution to achievement of the global targets of the Millennium Development Goals. This effort will lay a firm foundation for our work, shaping a new agenda as we continue our quest for equitable development beyond 2015. With this goal in mind, our 3-day meeting will focus discussion on the health of the people of the OIC member states, a continuation of deliberations in previous conferences in Kuala Lumpur, Tehran, and Astana in 2007, 2009, and 2011, respectively. During these conferences, we initiated the discussion to find ways to address several issues, such as maternal and child health, as well as broader issues, such as nutrition, communicable and non-communicable disease control. We also had discussion focused on various options for ensuring reliable supplies of good quality, effective, and affordable vaccines, which His Excellency the Ambassador, the ASG of the Secretariat, has so eloquently underscored. Overarching the various individual challenges related to health, we also consider the wide-reaching and important topic of health system strengthening. Excellencies, distinguished delegates, ladies and gentlemen, common effort in health is an important and well-recognized aspect of human development and poverty alleviation among the OIC member states. Without progress in the field of health, assuring the resilience and productivity of our people, other aspects of development are hampered. It is a field which needs to be pursued individually as well as through joint Islamic action. The OIC 10-year program of action provides guidance on cooperation amongst the OIC member states and emphasizes our concern with mother and child health as an issue of priority concern throughout our countries. I believe that our theme, better nutrition, better health, better ummah, can inspire and guide us in reaching the objectives of this conference with the goal of improving the health and wellness of the ummah. I am also certain that this biennial meeting will facilitate and strengthen multilateral cooperation among OIC member states in the field of health. Excellencies, distinguished delegates, ladies and gentlemen, in closing, again I would like to express gratitude and appreciation for the confidence expressed by the membership of the OIC in giving Indonesia the privilege of hosting this fourth session of ICHM. At the same time, let me underscore that it is imperative for us to continue working in concert if we are to ensure positive results of the 3-day meeting and reach significant progress in the field of health for our people thereafter. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. May I invite the conference to adopt the draft program of work? I see hands nodding. Thank you. The draft program of work of the Fourth Islamic Conference of Health Ministers is adopted. Colleagues, friends, Your Excellencies, we have a very heavy work program. Therefore, I would like to propose that we convene our conference sharp at 9 in the morning and proceed as scheduled.
The theme is certainly timely as we are approaching 2015 because ensuring proper nutrition will help to reduce the gaps and expedite towards achieving the 3 health-related MDGs and other MDGs too. Related to the report by the Secretary General, in principle, Brunei fully supports the actions proposed in the report, particularly the adoption of the implementation plan for the OIC Strategic Health Program of Action, which have been thoughtfully divided into 6 thematic areas of cooperation, as well as the other action areas, in particular the strengthening of training and the capacity building, as we believe that this is the most challenging aspect of sustaining health. Our country, through the Ministry of Health, has made strategic investments in health and has formulated the National Health Policy
At this juncture, Indonesia is pleased to know that we have finally adopted the Strategic Health Program of Action of the OIC member states 2014-2023 and its implementation plan. Indonesia, as the new chair of the ICHM, looks forward to working together with other OIC member states and the international partners in the implementation of the program of action. Furthermore, we believe that implementations must be properly monitored so that we are well informed how the organ succeed in implementing the many programs contained therein and to ensure maximum benefit of the program to all OIC member states in increasing the health status of the Ummah. In doing so, Madam Chair, we will need to bear in mind the different conditions and capabilities of each member states. Self-reliance in supply and production of pharmaceuticals, including vaccines, as well as sharing thoughts on OIC's potential contribution to the post-2015 development agenda. Let us hope that the panel discussions will enlighten us on the various issues covered and will assist us in coming up with new initiatives for future cooperation. Finally, Madam Chair, my delegation stands ready to discuss Coorperation of the Jakarta Declaration on Health and resolutions emanating from the panel discussions. All of these constitute important steps forward in our efforts to raise the health status of our people and build better health systems to serve them today and into the future. Thank you, Madam Chair.
On another note, we would like to acknowledge the Secretariat of ICHM and SESTIC, the Statistical, Economic and Social Research and Training Center for Islamic Countries, for the preparation of a comprehensive document titled OIC Strategic Health Program of Action 2014-2023. We believe the report has appropriately highlighted how much we have achieved MDG goals, what are the current gaps and challenges, and the necessary steps that OIC member states should take to fill the gaps. On the other hand, the document shed light on the possible barriers as well as future actions in achieving the goals set for post-2015 Global Health Agenda. Thus, we would like to give our sincere appreciation for performing such a comprehensive study and compiling its multidimensional report. We are of the opinion that the OIC member states should benefit from OIC Strategic Health Program of Action, and one of the recommendations that I would like to highlight is collaboration of OIC member states on producing vaccines and medications. Such an initiative can help OIC member states to combat communicable diseases, which put a huge burden on the health system and economy of those countries. Furthermore, those collaborations can strengthen the health status of OIC states in line with the Millennium Development Goals and post-2015 Global Health Agenda. One of the successful experiences on inter-country collaboration which merit to be mentioned here is G5 mechanism. G5, which is a group composed of four Islamic partners, 4 countries, Afghanistan, Iraq, Pakistan, and Iran, and enrolled WHO, has improved inter-country coordination and sharing best practices between its member states, such as addressing cross-border issues, for example, better coordination on fighting malaria. We believe similar initiatives as G5 can be constructive in other sub-regions, and OIC should support launching sub-regional groups to strengthen health situation in its member states.
My government is giving too much important priority to this sector. It relates to human development and poverty alleviation. The government is determined to eliminate disease and best health for the people and enable to pursue their well-being and achieve socio-economic development and objective. The government is working for effective prevention and treatment of diseases and pandemics, promoting health care. At the same time, we are strengthening laws aimed at preserving the rights of children, enjoying the highest possible health level, taking effective measures to eradicate polio in the country. The national health policy has achieved a lot of success, and people, they have achieved a good high quality of life. We are facing challenges, but our national action plan is going on very well. In conclusion, I can congratulate Indonesia for hosting this Health Ministers Conference and for its success. Thank you.
We declared a renewed promise to bring down child mortality rate to 20 per 1,000 live births by 2035. About immunity 5, we are well on track and we wish to achieve immunity 5 target by 2050. Our challenge will be to sustain the achievement to the post-2015 period. Bangladesh has adopted a country accountability framework on information and accountability on women and children health. Under the initiative, we have started registering and tracking every pregnant woman and under 5 child to ensure that none of them remain outside requisite health care. At the end, we call upon the member states to focus on holistic and universal health coverage for the best health of all our citizens throughout life course. Bangladesh believes that the conference will provide an opportunity to our member states at the OIC to find the best solution to our existing health problems. We wish success of this conference. Thank you so much. Assalamu alaikum.